Imagine you wake up in the middle of the night with severe pain. You go to the emergency room. A doctor examines you. Maybe you get a scan or some blood tests. A few hours later, you go home. Then the bill arrives, $3,000 or $5,000, sometimes even more, for a visit that might have lasted only a few hours. Emergency room bills are one of the most surprising costs in healthcare. But the reason behind those prices has less to do with the visit itself and more to do with how emergency systems are designed. Today, we'll break down why ER visits can be so expensive. One surprising aspect of emergency room billing is something called the sticker price. Hospitals maintain internal price lists known as charge masters. These lists contain the official prices for thousands of medical services, tests, and supplies. But these listed prices are rarely what insurance companies actually pay. Instead, insurers negotiate lower rates with hospitals. For example, a hospital might list a CT scan for $5,000, while an insurance company may only pay $1,500. Because of this system, the price that appears on a medical bill can be very different from the amount that is ultimately paid. However, patients who are uninsured or who receive out-of-network care may sometimes see charges closer to those original prices. This pricing structure is one reason ER bills can feel so confusing. But the most surprising reason ER visits are expensive has nothing to do with the treatment itself. Emergency rooms operate very differently from most medical facilities. Unlike scheduled clinics, ER departments must be prepared to treat almost any condition at any time. Doctors and nurses must be ready to handle heart attacks, strokes, severe trauma, infections, broken bones, allergic reactions, and many other emergencies. This means emergency departments must maintain a wide range of specialists, equipment, and treatment capabilities, even when very few patients are present. That constant readiness is one of the biggest drivers of ER costs. Emergency departments never close. They operate every hour of every day. Hospitals must staff emergency physicians, nurses, technicians, lab workers, imaging staff, and support teams. Even during slow hours, many of these professionals are highly trained specialists, and maintaining these teams around the clock significantly increases operating costs. Emergency departments also require advanced medical technology. Many ERs have immediate access to CT scanners, MRI machines, ultrasound equipment, laboratory testing, and cardiac monitoring systems. These tools allow doctors to diagnose life-threatening conditions quickly. But the equipment is extremely expensive to purchase and maintain. Hospitals must recover these costs through the services they provide. Emergency room doctors often order multiple tests very quickly. This isn't just about generating revenue. It's primarily about reducing risk. In emergency medicine, doctors must rule out the most dangerous possibilities first. For example, if a patient arrives with chest pain, doctors may order blood tests, an electrocardiogram, a chest x-ray, or sometimes a CT scan. Many of these tests are performed within minutes. Even if the final diagnosis turns out to be something minor, those tests were necessary to rule out life-threatening conditions. Each test adds another line to the bill, and together they can significantly increase the total cost of an ER visit. Another unique feature of emergency rooms is the triage system. Patients are not treated in the order they arrive. Instead, they are evaluated based on the severity of their condition. A patient with chest pain may be seen immediately. Someone with a minor injury might have to wait longer. This system allows ER teams to prioritize life-threatening emergencies, but it also means the department must remain prepared for the most serious cases at all times, even when treating relatively minor issues. Emergency rooms also treat many patients who cannot pay for care. In the United States, hospitals are required to treat emergency patients regardless of their ability to pay. This law is known as EMTALA, Because of this requirement, emergency departments often provide large amounts of uncompensated care. Hospitals must balance those financial losses across other services, which can contribute to higher prices for ER visits. One surprising part of ER bills is something called a facility fee. This fee covers the cost of maintaining the emergency department itself. It includes staffing, equipment, supplies, and emergency readiness, even if the medical treatment itself is relatively simple. Patients may still receive a facility charge simply for being evaluated in the emergency department. Most people visit emergency rooms during stressful situations, when the focus is on getting medical help quickly. Few patients think about the financial structure behind emergency care, but ER departments represent one of the most resource-intensive areas of healthcare. They must maintain advanced equipment, specialized staff, and constant readiness, even when patient volumes fluctuate. When those costs are divided across individual visits, the resulting bills can feel unexpectedly high. Another factor behind emergency room costs is what some experts call defensive medicine. Because ER doctors often treat patients they've never seen before, they must make decisions with limited medical history. To protect patient safety and reduce legal risk, doctors may order additional tests or monitoring. These extra precautions help ensure serious conditions are not missed, but they can also increase the cost of care. From the hospital's perspective, the goal is to avoid missing a dangerous diagnosis, even if that means ordering tests that ultimately turn out to be unnecessary. Imagine someone arrives at the emergency room with abdominal pain. Doctors need to quickly determine whether the cause might be something serious like appendicitis. Within a short period of time, the patient may receive blood tests, imaging scans, and medications, along with monitoring by nurses and physicians. All of these services occur rapidly. From the patient's perspective, the visit may feel routine. But behind the scenes, multiple departments are working simultaneously to diagnose the problem safely. That coordination and readiness is a major reason emergency care can be expensive. Emergency rooms play a critical role in modern healthcare. They provide immediate care during some of the most serious medical situations. But maintaining that level of readiness requires significant resources. And those costs are reflected in the prices patients sometimes see after an ER visit. Understanding how emergency departments operate helps explain why those bills can be so surprising.